GLP-1 medications like Ozempic and Mounjaro have literally transformed weight loss, but are they making people look older? Many of you have heard of the Ozempic face and the scary stories associated with it. You know, people have been on these medications and suddenly look 10 to 15 years older. Is there any truth to that? And I can tell you firsthand as a facial plastic surgeon that there is truth there. And I think by the time you end up watching this video, you're gonna feel like an expert and you're gonna have clarity on this topic of GLP-1s and what they do to affect facial aging and how to manage and treat them. And for those of you who don't know me, I'm Dr. Karam. I'm a board-certified facial plastic surgeon specializing in facial rejuvenation. I'm also the founder of Karam MD Skin. So let me give you a quick overview of what's coming up in this video. So number one, we're gonna learn about how GLP-1s work. Next, we're gonna talk about why and how they cause fat and muscle loss that affects the face. We'll talk about the differences between normal weight loss and weight loss induced by GLP-1s. And finally, we'll put it all together and come up with a strategy that in many cases may help prevent some of these unwanted changes. But for those that have the changes and want to understand what's the most direct and predictable and reliable way of treating them and restoring your face, I'm gonna give you the answers there as well. Who is this video for? Anyone who's losing weight, people who are considering GLP-1s or who are on GLP-1s and really wanna understand this entire story and basically be able to take action in the right way. Before we get into it, make sure you subscribe to this channel so you can always get these type of videos and learn a lot about facial rejuvenation. So without further ado, let's break it down. All right, what is GLP-1? So GLP-1 is a glucagon-like peptide. It is a synthetic form of glucagon, which is a naturally occurring hormone in the body. And it's an agonist, meaning that it behaves just like the natural occurring hormone. So what does that hormone do in the body? First, it delays stomach emptying, which makes you feel fuller longer. And I did an entire video actually on the dangers of using Ozempic when it comes to having different types of surgery, because there are some deaths associated with Ozempic and cosmetic facial procedures, and it really has to do with the timing of when you should stop the Ozempic or any type of GLP-1 because of the gastric emptying issue, and when you can have safely a surgical procedure. Now, those guidelines change all the time, so definitely want to research that before you have a surgery or let your anesthesiologist know. Number two is it suppresses appetite by directly affecting the hunger centers in the brain. So you feel basically full. You don't think about food and therefore you're not craving. Next, it regulates blood sugar levels by affecting insulin levels as well as naturally occurring glucagon. And finally, it enhances metabolism, which basically increases the rate of fat burning and also breakdown of any type of caloric storage forms, which is naturally occurring glucagons, as well as muscle. And this is a very important category here because, you know, you think about people who are on Ozempic or some of these GLP-1s, they're on it because they're trying to lose 20, 30, 40, 50 pounds of weight, maybe greater, right? And it's for like an obesity treatment. But in reality, today, many people are using it in a microdosing fashion, which a lot of times is just for people who are trying to lose between 5 to 15 pounds. And a lot of that's for stubborn weight that has been nearly impossible to get off the body because of changes in body metabolism. So you're eating right, you're exercising a ton, you're doing weights, you're going on a low caloric diet, etc., but you can't shed those last 10, 15 pounds. And that's where microdosing for a lot of people have come into place by stimulating and basically reinvigorating the metabolism and getting that weight to drop. This is probably one of the most common areas and probably the area that you're gonna see the greatest number of people entering the GLP-1 market is microdosing and treating these kind of stubborn 10, 15, 20 pound weight that feels nearly impossible to get off the body. And everything we're gonna talk about today addresses both big time weight loss, but also the type of weight loss that affects microdosing regimens. All right, so let me explain a little bit about facial fat loss in general. When we age, we lose facial fat. Underneath the eyes, above the eyes, what we call subobicularis fat pads, the temple, deep temple fat pads, the prejowl fat pads, the lips, these areas lose volume no matter what weight you're at. So there's a natural type of volume loss that happens, but those affect the deep fat pads. When you lose a lot of weight or when you're on a GLP-1, what you're losing is subcutaneous fat. And what is subcutaneous fat? It's superficial fat. It's the fat that's right underneath the skin. And that is the fat that you start to see dissipate or get reduced when you lose weight. That kind of fat loss happens no matter what the mechanism of weight loss is, whether it's through GLP-1s or you go on a diet and shed a bunch of weight. It's that subcutaneous fat that causes the cheeks to become hollow. It causes the eyes to look more sunken, temples to look more sunken, because in addition to those deep fat pads, the superficial layer of fat is starting to decrease. And when that happens, suddenly the face ends up looking more gaunt, but also sagging starts to look more exaggerated because there's not that support underneath the tissue. So as that subcutaneous fat layer begins to diminish, there's not as much structure to the face anymore, and then the face and skin start to sag. So how is this different than normal weight loss? There is literally no difference. The same areas are being affected. The difference is the rate of fat loss. It's the rapid loss of weight and fat that causes the skin not to be able to adapt to this change in volume in the face, which then suddenly causes everything to crash. Now, it's a tale as old as time. You know a family member who's lost a bunch of weight, and then all of a sudden, their body looks great and they're healthier, their hypertension goes away, their blood lipids look better, cholesterol looks better, diabetes improves. However, all of a sudden they look like 15 years older. So this is not a new thing. Now, there's an interesting point here to make. When you're younger, there is so much collagen and elastin in your skin, and normal weight loss happens gradually over time, that your skin is able to shrink. Now think about this for a second. Think about pregnancy. Think about bodybuilders. The skin is elastic in most conditions except for old skin, because elasticity is what allows the skin to basically expand and recoil depending on what the deeper structure is doing. So during pregnancy, you're in your 20s or 30s and you get pregnant, your stomach goes out to here, and then baby comes out and things start to settle, and all of a sudden, you may have a little bit of extra skin looking. For the most part, a lot of that skin has returned back to normal. In the face, when you are in your late 40s and early 50s, your collagen production, as I've talked about in many videos, your elasticity, all these things have diminished to a point where weight loss, especially if it's happening rapidly, the skin has no time to adapt. All it can do is just sag and fall. Now, that's the underlying mechanism that causes a lot of this Ozempic face conversation. There's nothing you can do about it except for improving the quality of the skin and letting the skin adapt to the weight loss in a more gradual way. Now, it kind of defeats the whole point of getting on these drugs if you're gonna take a year and a half to lose that weight. Frankly, I don't think it's a very practical approach, but that's the concept. Rapid versus gradual weight loss can allow the face to adapt differently. So this is actually a really important point to take home. There is no difference by GLP-1 induced fat loss versus natural dietary fat loss, period. There's not some kind of magical or negative effect that's coming from GLP-1s that are causing this. So this is something very important. Now let's switch gears and talk about muscle loss. So can GLP-1s induce muscle loss? The answer is absolutely. 20 to 40% of the lost weight comes from lean tissue, and muscle is a part of the lean tissue structures. So in addition to fat being lost when you lose weight, you're also losing some muscle in many cases. So how does this happen? Well, if you decrease your appetite, you're probably gonna eat less protein. So in response to that calorie deficit, your body begins to search for energy sources. What are energy sources? One of them is fat, which is what you want. The other one is muscle, which you don't want. So it breaks down both of them to get some energy to do its daily activities and normal body functions like fueling your brain, breathing, daily activities, etc. And if you're exercising on top of that, well, your body's gonna start to look for other sources within itself, and that's where the weight loss happens, the combination of both fat and muscle diminishing. Now remember, face has lots of different muscles associated with it, muscles in the neck, muscles throughout the face, etc. So in addition to those weight-related structural changes, the muscles begin to thin and get lost as well. So overall, you start to see an increase in sagging and facial aging changes associated with some of that muscle loss. So to answer that question, does GLP-1s cause more muscle loss than normal weight loss? The answer is no. There's been a number of clinical trials that have basically showed that there's an equal, no different, change in muscle mass loss with regular weight loss versus weight loss induced by GLP-1s. And that the underlying mechanism is not the weight loss in general, but it's rapid weight loss that's causing the more accelerated muscle loss. So how can you prevent this process from happening? Number one, you want to do things that are going to improve your skin. Your body is losing collagen, typically as a result of changes in estrogen levels. As estrogen level decreases, collagen begins to diminish at the same time, and collagen is a structural protein of skin, which is really, really important for integrity. But also, in addition to collagen, there's elastin and keratin and these other component proteins that really help the skin look young. You have to get yourself organized on something that's going to improve your collagen production and all those other proteins that I just mentioned. So retinol, vitamin C, niacinamide, peptides are really important. You want to hydrate the skin, you want to moisturize the skin. Hyaluronic acid and lipids are really helpful for that. All of those things work synergistically with one another, and they can all boost collagen, elastin, and keratin in different ways. So using them all in conjunction with one another, you're going to get the maximum effect. That's the thinking that went into the trifecta, which is, as you know, the skincare that I developed that puts all of that together in basically 3 steps. The concept is that your approach to skincare needs to be comprehensive in order for it to be effective, and you need to do it on a regular basis. If you're doing this on a regular basis, now you can improve your skin and build some of that skin elasticity and collagen, but it's going to take time. So if you're in the business of losing rapid weight loss, like you're going to do it, in the next 6 months, you're probably not going to get to improve your skin's collagen elasticity, because those are slow changes that happen over months and years. That's why we recommend this type of skincare approach for literally forever. But it's important to understand that, just as a general point, that's an underlying reason, and those are the things you can do to improve the elasticity of the skin, which ultimately is such an important quality of young-looking skin. The other aspect is your strategy for the loss of the weight. If you can lose your weight a little bit more slowly, and this really pertains to people who are younger. And I'm going to differentiate this for a second here. If you're in your 20s and 30s or early 40s and you lose weight, whether it's a little bit more rapidly or a little bit more gradually, your skin is more likely to adapt and recontour to its smaller shape. If you are in your late 40s, early 50s, and 60s and you lose that weight, in my opinion, there is literally nothing you can do, whether it's slow weight loss or rapid weight loss. That facial soft tissue is going to fall, and there's not going to be enough elasticity in the system to basically conform to that new, smaller face. So that is the difference between going on these drugs when you're younger versus going on these drugs when you're a little bit older. If you do lose the weight at any point in time, you're going to see your face look older. This is an unfortunate reality. Now, my personal take on it is metabolically and from your health point of view, not carrying a lot of extra weight, especially if you've got prediabetes and cholesterol issues and a history of heart disease or cancer and all the other things that we know weight and obesity can contribute to. Certainly, I would say weight loss, no matter what, is a better outcome than whatever happens to your face. It's just one of those cost of doing business situations, and we're going to talk about how you can actually treat it in a moment. But if you're in one of these kind of situations where you're thinking about microdosing, you've got about 10 pounds, 15 pounds you want to shed, my experience with all of my patients is that you're going to also see your face age quite a bit when that 10 pounds comes off. So it's something you need to consider, and if it's worth it to you, then do it. Obviously, 10, 15 pounds probably is mostly for how you look, partly based on metabolic and physical health reasons, but mostly 10, 15 pounds isn't going to make a huge dent in that department. But at the end of the day, this is the cost of it. Now, having said that, let's talk about treatments. Now, you've heard a lot about using protein, between 1.5 to 2 grams per kilogram of your body to basically prevent loss of muscle that might happen as a result of, decreasing your overall calorie intake, etc. So supplementing with protein powders and eating high protein diets, etc. Frankly, those things aren't going to affect your face that much, right? Because again, this is more of a scaffolding change than it is that. But 100% I'm on board with the need for doing those type of things for your general health and keeping body muscle. Remember, sarcopenia, the loss of muscle, is something that happens associated with aging. The last thing you need if you're in your 50s and 60s is to accelerate that process with, suddenly having a lot less calorie, which unfortunately is something that we see all the time with people who are on these meds, is they lose their appetites and don't want to eat a lot, and as a result, their muscle waste a lot faster. So really being conscious of that. Also being really conscious about using weights and resistance training to kind of build your muscle stores back up, focusing 3 to 4 days a week on resistance and heavy weight training to kind of build and keep that muscle in check despite the fact that you're losing overall body weight. That's important. Now, that's a foundational thing. Nothing to do with your face. Here's a question. Will RF microneedling, things like Morpheus, threads, fillers, etc., do they play a role in managing facial aging changes associated with GLP-1s or weight loss? The answer is no. It's the same answer that it was when you didn't lose the weight and you were just aging. It's the same answer. Those things aren't going to cut it. They're not going to take care of the underlying problem. In fact, using things like Morpheus 8, which distributes heat in the subcutaneous fat layer, 4 or 5 millimeters below the skin, which is exactly where the fat is, you're probably accelerating the loss of subcutaneous fat, which is probably the worst thing you can do in a situation like this. So 100% no on things like RF microneedling, therapy, none of that's gonna help. Using fillers to try to replump the face, this is not a grape to a raisin situation. This is completely a different problem. Remember, there's inevitable aging changes that are coming and affecting everyone no matter what. If you're above the age of 50, you're starting to see things start to sag a little bit. And it's gonna get worse year after year after year. That's just an inevitable reality. No one's gonna stay young forever. But when you lose the weight, even like I said, 5, 10, 15 pounds of weight now, let alone much greater, there's gonna be a significant change in that. So putting a little bit of fillers in your cheek or a lot of fillers in your cheek, that is not going to take up this overall volume loss that has happened, that has caused everything to become accelerated and fall down. So don't make that mistake. Don't waste your money on these type of treatments. That's not going to cut it. So what's going to fundamentally treat it? You probably already guessed the answer. It's going to be surgery. Now, the surgery in this type of situation is you don't want to go in there and have some like mini lift type of a procedure. And I did a whole video on why those type of procedures don't work. This has to be addressed fundamentally. It has to be addressed at the deep fascia layer. It has to address the muscles of the face. I have to bring everything, including the neck, everything back up. The vertical restore has been an amazing treatment for patients who have had facial aging, who want to look natural, who want to restore their face back to where it was. And that applies directly to whether it's accelerated because of weight loss or because of normal aging. But if you don't get a vertical restore, which is a trademark procedure that I only perform, a deep plane facelift over a standard or traditional facelift or a mini lift is a significantly better approach to addressing the fascia of the face and neck. Now, in addition, I always add fat transfer to the mix because, like I said, there's specific areas of the face that lose volume. You cannot replace, and this is important, you cannot replace subcutaneous fat, the fat that's right underneath the skin, anywhere in the face. If you try to, you end up getting lumpy, bumpy. So if even you try fillers and things like that, it's going to turn into a disaster. But when I use fat transfer, I'm putting it in those select areas, and those are all in the deeper layers of the face in those specific areas that I mentioned, temples, around the eyes, lips, and pre-jowls. I do that in conjunction with it, and then, lo and behold, the person looks like they used to, despite the weight loss. Now, what's fascinating is I had a patient who did a vertical restore and a fat transfer, and then subsequently lost 70 pounds of weight. Now think about that. You would expect the whole face to fall apart as a result of this. This particular patient barely budged 70 pounds later after a vertical restore and a fat transfer. So that tells you that that structural support that comes from the surgery is not just durable, but it's enduring any type of weight fluctuation and really does help maintain through these ups and downs that happen. Despite the fact that there's a significant improvement in her facial aging changes, there has not been any increase in laxity. So it's a very durable and reliable and safe operation. I love seeing these type of cases because they give us more confirmation and confidence about what we're doing at that deeper level.
How old are you?
I'm 74.
How much weight have you lost in the last year?
I started, I think it was about 10 months ago, and I think I probably lost close to 70. My whole life I've struggled with it. I could lose 30 pounds, and that would be it. I just would gain it all back.
Yeah.
So I probably did that many times.
What GLP-1 have you been using?
About a year ago, I tried Ozempic, and I was sick as a dog on it. I might have given it a month. It just felt bad. So I went off it, did a little more research, and decided to try Zepbound.
Okay.
And that has been like a miracle for me. I brought it to my doctor's attention. She thought it was a good idea because being so overweight, I was on high blood pressure pills, cholesterol, very high doses, medicine for my heart.
Are you off that now or
from
lower
heavy
dose?
Doses to down to tiny pills, which are like 5 milligrams.
That's amazing to hear. I'm so happy for you. You must feel
Me too.
so much better.
Definitely. I did see change in my face much more drastically in the last 2 or 3 months. The weight loss, primarily the sagging. I'm doing the vertical restore, skin pinch, lip lift. I wasn't going to do it unless I had lost weight. It wouldn't make any sense. I'm excited that it's here. It's here.
All right, so here's a recap and some key takeaways. So number one, changes in weight, no matter where they come from, GLP-1 induced or diet and exercise, etc., lead to a change in fat and muscle loss. And in order to resist some of this change, it's important to shift your lifestyle towards a higher protein type of a diet and improve your muscle training and resistance. This is general health 101 when it comes to weight loss, especially as we're aging. When it comes to the changes that are associated with your face, you're going to have to basically accept those changes because they're gonna happen with even the slightest bit of weight loss. And this is nothing scary. It's not an Ozempic face, specific type of a problem. This is just that you're heading in this direction no matter what, and the weight loss is just gonna speed things up a little bit and it maybe even magnify it a bit because of the weight loss. In my opinion, I would personally take a lower body weight, facial changes, and as a result of that, do the things that need to be done to restore my face if that was important to me. But I wouldn't keep weight on my body just to keep my face because those changes are gonna happen no matter what weight you're at. Unless you are one of these people who aren't ready to have the surgery and you're contemplating doing some of this like 10 to 15 pound type weight loss and you're in your late 40s and you don't want to tip the scale just yet, take that into consideration. Best advice I can give you, because once you lose that weight, boom, things are gonna really, really show. But if they do happen, now you know, don't waste your time and money on things that aren't going to address it. Don't fall for things like RF microneedling, threads, and excessive fillers and stuff like that. That's not gonna do it for you, really important. Save up, research, find a surgeon who you believe will give you a beautiful result, do a deep plane type of a procedure, do a vertical restore, get a fat transfer, and enjoy your new weight and your new body and health, etc., and a younger looking face. If you have been on a GLP-1 or experienced some rapid weight loss and you notice changes in your face, I'd love for you to share your stories and drop them in the comments below. And if you're interested in learning more about the vertical restore or what I can do to potentially help you if you're in this position, take a look at our website, drkaram.com, have a look at some other videos that show how facial rejuvenation can be done in a very natural looking way using the vertical restore and some of the other treatments that I associate with. All right, folks, I hope you enjoyed this video. I hope you learned something. This topic of GLP-1 induced weight loss is not going anywhere. It's probably gonna become more and more popular. Already as surgeons, we've seen a significant rise in the number of facelift inquiries and interest in this type of surgery because of it. So share this with some friends. If you enjoyed it, hit like, and do not forget to subscribe. And if you wanna learn more about this, take a look at the Karam MD Journal. It's a free newsletter that comes directly to your email. All right, folks, my pleasure. Have a great, great day. Thanks so much, Dr. Karam.